Okay. So, hello, welcome. My name is Vicky and I am founder of Experts today. And today I am chatting with Mary. Mary is a registered consultant with us here at Experts today. And the service that Mary offers is that she assists organisations in reducing the impact of absenteeism by intervention with employees that are returning to the workforce. Would I be correct, Mary, in what I've just said? Is that the service that you provide?
That's it, absolutely. Yes, Vicky, it is indeed, and delighted to be talking to you today. So yeah, the service is all about really promoting attendance within the employees coming back after an illness or an absence, or even a planned leave such as maternity leave or sick carers leave, or even a leave of absence for a year out or more. And really just encouraging their attendance to come back in a very supported way so that their return to work is sustainable and the person can pick up their job and continue working with their career and planning their career. So yeah, that's it.
Perfect. And I suppose in this day and age with the cost of the impact of cost to businesses in trying to engage with our employees returning to work after sickness or illness, there's probably a huge benefit to businesses actually implementing this type of service.
There's a number of benefits to it. There is the benefit that it does help reduce costs because over time, as the person's absence, the increase of the absence, and so you've got the cost of maybe having a person who is in work being on overtime, or you might have to bring in maybe agency staff to fill in that the absent employee. And then you've got the manager's time who is looking after and trying to coordinate that person's return. So you've got, when you have somebody external to the organisation come in and do that, so you've got the manager's time given back to them to give them the time to come back to their ordinary job. And you've got the added expertise of somebody such as myself who is experienced in supporting people back to work. And in some cases, the cost of my service is grant aided through grants that are available through the Department of Social Protection, and that covers a significant part of my costs. There are also costs that can be covered through equipment adaptation grants, and they will cover costs for, if there's maybe some kind of small structural changes, or if there's equipment that is needed, or chairs if somebody's coming back with maybe a back injury. They can all be covered by the cost of some of the grants. So cost is a huge benefit, but there's also other costs when a person comes back after their absence is over. The productivity goes back up. If they are especially if they're directly involved in production. If they're in a sales role, obviously sales will increase then again. You've got the well-being of the entire staff, not just the individual person who's coming back, but the well-being of the entire staff is addressed, because if everybody sees that their colleague is being looked after and being supported in their return, they can be assured then that if anything were to happen to them in their lives, they know that they will be supported and assisted to make a full return back to work as well. So it's really important for the entire organisation to do that. And then from a legal point of view, employers are under reasonable accommodation that is included in the Employment Equality Law, that they, as an employer, have to investigate how to reasonably accommodate a person coming back after absence if there is a challenge. So by engaging with me, that covers the reasonable accommodation requirement for an employer. And then you would also have, if a person is supported in their return, it reduces the risk of them maybe having a relapse, because if the return to work is properly planned, then person comes back in a very safe manner. They're supported. It's a sustainable return to work. So that again reduces the risk of a potential relapse for that person to go out again.
Mm-hmm. And I can imagine it's probably quite difficult, or somewhat emotional or mentally, an issue for people that if they have been out of work for whatever reason, may it be an illness or an accident or just, maybe bereavement in the family or something like that, coming back into the workforce can be pressurized at times, especially if things are changing so quickly now that having that added support and on a one-to-one basis to assist them back into the workforce is very beneficial to the employees. And they would probably really appreciate that an employer has gone out of their way to actually provide that support to them.
Yeah, that's all absolutely why the service is so much needed. So when a person's coming back, regardless of what the cause of absence is, mental health will actually have a significant impact. So by the time a person is a month away from their work, their mental health will already start being impacted because, it's natural to think, who's doing my job? Is it being done better, or is it being done at least as good as I would do it? If they're not having connections from work, they're wondering, what's going on, what's changed, what systems are changed. So when you are out, then maybe 6 months or a year, then that is a huge gap of time to be distanced and isolated from work. So the stats would say that by 6 months, 50% of people don't return to work, and by 12 months, 80% of people do not return to work. So if you just take some examples, I worked with a lady that was coming back after maternity leave, and that was in 2018. So when she was out, the whole GDPR regulations came in. So when she came back to work, she was actually planning her return with her employer, and they actually asked her to come back in and do between 2 to 3 days training before her return, because in her role, GDPR was going to be a huge issue for her in the data that she was handling. And that was just enormous to her because she was already nervous about her return, but then having to handle all of this extra on top of her. So that's one example of where the added pressure of coming back can play a significant role in how you feel about going back to work. Mental health is enormous, for people who are coming back after even just post-surgery, and it's not even a very traumatic thing. It could be, just a regular surgery, you still are worried about how you're going to cope for the first, maybe a couple of days or even a couple of weeks. But if you complicate that with an ongoing health challenge, such as maybe cancer, and the mental health that, surrounds all of that, having come through this life-altering condition, and for it to be still in the back of your mind, the mental health is a huge aspect to that. So when people receive support and assistance and encouragement and assuredness from their employer, and the compassion to say, it's okay, we're going to work with you, we're going to help you. Could you imagine the relief that must be to an employee? And that is why this service is just, in my books, that's why it's so needed.
Yeah, and I'm going to assume, and you can correct me if I'm wrong, that if you're working or supporting maybe an organization or that has like several employees or multiple employees, that part of the service may be to give them guidelines on how to engage with the returning employee. Would I be right or wrong in that?
Yeah, no, you're absolutely right. Yeah, and regardless of the size of the organization, once you have an employee, then that person is at risk at some point in their working life to have a challenge in their life that they just might need assistance with. And just to give you another stat, 80% of people with disabilities acquired their disability within their working life. So that's between 18 to 65-year-olds. 80% of them acquired their disability during their working life. So, so to come back to that, then so the whole support and the relief, so regardless of the size of the organization, is huge. So the support is kind of like two-pronged, and they both work beside each other. So the support is there to the employee, but it is absolutely there for the organization themselves. So if you take the example of somebody coming back after maybe a bereavement, and maybe the team aren't quite sure how to approach this person, in particular if there's been a suicide within a person's family. So they're coming back to their team, and unfortunately suicide is a huge part of our society these days. So when a person's coming back and there has been a suicide, and the team are wondering, how should we, approach, our colleague? What are we going to say to them? How are we going to say to it? How are they going to feel about coming back? So I work with the organization to prepare them for that. So that support takes place by first speaking to the individual themselves and saying, okay, imagine you're there at work and it's your first day. How do you want people to approach you? What do you want people to say to you? Or do you want to control the situation? And do you want to approach people and you talk to them and you initiate the conversation? So by having the conversation with the individual and planning their return, it goes very much back to the organization saying, as part of their return to work plan, this is what they would like, this is how they would like conversations to start, or they would prefer to initiate the conversation themselves, and they will do it when they're ready. So, yeah, so the support is it has to be both sides, and both are prepared and both know exactly what the other wants, because that's how it's sustainable, and both sides know what each other wants.
Okay, perfect. And I'm just thinking, the times that we're in it, that the economy is booming, and it can be very difficult for companies to retain staff. So it's vitally important for an organisation that if they have a member of staff that is out or an absentee for a period of time, that it is really in their benefit to assist that person return to work. And I'm assuming, and again, I'll go back to, I suppose, making the assumption. Well, I suppose I'm taking it from my point. If that were me and an organisation was going to that effort to ensure that I felt comfortable returning to work, I would actually be very loyal to that organisation, and I would want to remain and do my best and be more productive. The fact that they've actually gone, to me, that would be, going over what would be expected to this point, but hopefully it's something that would become a regular occurrence in all organizations, that they would consider it.
Yeah, and that would be feedback that would have come through in the likes of America, where services such as mine would be quite prevalent. It's offered through an insurance regime over there, so it's slightly different to here, but that definitely is the feedback once a person goes through the system, that because they have received support and the compassion to be able to show that this company is willing to support their employee and they value their employee enough to do all this for them, that their loyalty to the organization, to their job, to their team, it does increase. It increases their productivity because they recognize that this is a company that cares for me as a person and me and my life. So yes, I'm going to stay here. And then their team see how this person's been supported and encouraged back. So it is also a huge support and relief to them to know in the future, should something happen, that would be looked after too. So it is huge. It's not just all about the individual and this person. It is a culture-wide program or approach or ethos, whatever word you want to put on it, but it's the culture of openness to mental health, to disability, to diversity, to inclusion, to everything that the modern workforce is, and all its varieties and shapes and formats that takes.
Okay, and I'm just thinking again while you're talking here that, rather than being reactive, companies should be proactive and maybe have this service or policies implemented into their corporate social responsibility, but allow, in also into their HR policy, that as an employee or if a new employee is coming on board, that is already in place, the service that could be in place, and that policies could be written in advance to assist.
Absolutely, that would be my preference, that organizations would have engaged with me prior, so that when a person does go out, they know, okay, when I reach week 3 going into week 4 of my absence that, that I will be in contact with them, that their number will have been shared with me, and that they know that this is part of the policy and procedure of the absence management and the return to work policy. So on that, I can write policies for organisations, and I have done, where I would write a policy on the return to work piece, because most organisations have a policy in place for absence management in terms of informing your employee that you're going to be sick and you're not coming in this day and providing the sick note. But very few organisations actually have an active policy on managing the return to work piece with the focus on the return to work. So I have done that for some organisations and tied that into policies that would be in place. So dignity in the workplace, mental health and well-being in policies that are in place. And I have written mental health and well-being policies for organisations, again, to tie everything in together. So yes, the preference would be that they would know of my existence, and that when a person goes out, then they know Mary's going to be in touch.
Perfect. And again, like, I mean, I know there are probably, like, the larger organizations would have HR departments, and a lot of people would think that HR would be responsible for this, and they probably are to an element, but there are probably, you know, as an individual, I think I personally would like to work with someone that's outside the organization, especially if you're on a one-to-one basis, and especially if it's very confidential information about myself. I don't necessarily want people within the organization to know about. I mean, what's the feedback on that? Do people prefer
that happens. So yes, I would be outside of the organization, and I wouldn't necessarily be privy to all the politics that might go on inside there. So if a person is out of work, or away from work, I should say, on say occupational stresses, and maybe the stresses are caused by maybe relationships at work, or workloads, or whatever the stressor is within work. So sometimes it is a huge relief to a person to speak to somebody outside of their organization, because they don't want to speak to anybody within the organization. But having said that, you know, you have to be realistic to a person with the individual and say, you know, if this is the stressor, then, you know, we have to bring that back into the work, because if not, it'll never get addressed and it'll never get resolved. But I think in terms of opening up the conversation and teasing out, well, what are the stressors and why are they the stressors, it often in cases is much easier to speak to an outside person who has no agenda within the workplace. So yes, being an independent, it is quite easy for staff to have that. And I'm more than happy to facilitate those kind of conversations, because invariably they do come up, and I've had people disclose to me that they've attempted suicide, that they are really nervous about going back to work, even though the cause for work has got nothing to do with work, or the cause for absence, I mean. And you know, it's, you know, I've done this role for, you know, for 3 years, and, you know, people come up with all sorts of stories, and some real hard stories, and really sad and really challenging stories. But I really, really do believe that there is a pathway back for everybody. They just need to have a door opened and a conversation to start the pathway back to. So there is a pathway back for everybody. You just have to find that person to start the conversation with.
Well, look, on that note, I think we might wrap this up, but you are definitely the person I would highly recommend.
I am unique in this.
To organizations that are serious about looking after the mental and well-being of their staff, no matter what size of an organization. And as you said, there is funding out there for various elements. Obviously, it all depends on the individual case and circumstances. But if there are organizations or businesses out there that would like to engage with you, Mary, I will be including a link to your profile on our website, so that they can read a little bit more about the service that you offer. And then if they wanted to reach out, they can contact me directly, and I'll facilitate the connection on your behalf.
That'd be great. Thank you.
So on that note, thank you for taking the time out to chat with me. found it very interesting, and yeah, I'm delighted to see that there is this type of service out there for organisations and to tap into, no matter what size they are.
Yeah,
It's
I
good.
just think
It's
it's
good.
really important. Yeah, yeah, that the modern workplace is so stressful. Life is stressful, and when you put the two of them together, the stresses are so huge and can be so overwhelming. So I just think it starts with a bit of compassion, and be able to do something for a person, and recovery is possible for everybody. It's just a start, and that's what I'm there to facilitate the start and to see it through to the end. And I'd be delighted to speak to anybody. And thank you very much for your time, Vicky. It's been great.
Very welcome, Mary. Okay, thank you. And as I said, if you're interested in contacting Mary, feel free to reach out to me, and I will discuss with you how that happens, and we can take it from there. Thank you. Bye.
Bye.